Okay, very good morning, doctors. Very good morning. So, actually, we'll just refresh ourselves with some of the questions, important questions from pharmacology. These are easy questions, but still, I just want to revise these topics, revise these questions in order to make sure that the basics of all of the doctors are exclusively strong. Why? Because INSAT mostly comes from the basics only. They don't want to go for in-depth use or in-depth in-depth analogy. They don't want to go for those type of things because they just want to go on the superficial layer, but that one a bit tricky, right? So without making any delay, we'll just get into the questions. Only 10 MCQs. It's just like a refreshing video. It's just sit and relax. We'll just make some fun part. Okay. So what is the most important subunit of GPCR? GPCR defines for G protein coupled receptor. So we'll discuss some details about GPCR. So GPCR is actually a 7 helical structured compound. It's a transmembrane receptor, right? So we have a G protein, right? That is, there is a attachment or presence of GDP at the alpha subunit. So when it gets activated, you get an addition of phosphate converting to GDP, then going on again, activation of enzyme, then again it converts to GDP. So this all takes place with the meanness of alpha only. So what is the most important subunit here? It is alpha subunit, right? Wait, I will just change the color. So remember, what is the most important subunit in the GPCR, G protein coupled receptor? It is alpha subunit. So that is the answer. Okay. Now the second question. All of these cause relaxation except. So this is actually a very good question. You take GQ, GI, G12 and GS. Now all of these cause relaxation except. Any answers? All of these initiate a mechanism of relaxation except one receptor. So you take GI or GO. You take GI or GO. You take G12 or G13, and you take GS. All these three people, they cause relaxation. But GQ, it causes contraction. Okay, so answer is GQ. Okay, now getting on to the next question. All are studied in phase 1 clinical trial except safety. Yes, you study. Toxicity, we study. Maximum tolerable dose, we study. But what we don't study is efficacy. So efficacy is the answer. We don't study efficacy. So a little bit, we'll just chisel some important points from the clinical trials. Very important topic, very important repeated topic. So you take phase 1, you check safety, tolerability. It's done in 1 to 2 years. It's an open label trial. Then what is the most important thing? It is done in normal people, right? Normal, healthy volunteers. But for example, if you want to try cancer medications, if the drug you are about to experiment or try is a cancer medication, then you can go and do it on the cancer patients, no problem with that. And one more exception is, if you are dealing with HIV medications also, you can just do this trial on the HIV patients. So that is the exception here. So exceptions don't bother, but the main points, that is safety, tolerability, maximum tolerable dose, 1 to 2 years. It's an open label trial and it is done in normal, healthy volunteers. Okay. Now coming to the phase 2. Phase 2 is exclusively done to determine the efficacy as well as the safety. It is done for 2 to 3 to 4 years like that. No need of all those those numbers, but the important thing is it is done in something like 500 people, right? And one more thing is it is called as therapeutic exploratory trial. It's also called as therapeutic exploratory trial. And phase 1 is called as human pharmacological and safety trial, right? Now coming to the phase 3, so this is the main important trial, that is the marketing trial. After the finishing of phase 3 only, you will go for marketing. After the clearance of phase 3 only, you will go for the marketing, right? So we will do something called post-marketing surveillance also. And we have one more phase, that is phase 0. It's also called microdosing phase. Microdosing implies we give 100 micrograms, very low dose, 100 micrograms. Now what is the advantage of this phase 0? What is the advantage of phase 0? Phase 0 is done. It is the initial trial that we do even before starting all these trials, that is phase 1, 2, 3, all this, before all these trials we do something called as phase 0 if we want to do. So that if we observe any side effects, we can stop here. We can stop here itself, so that we can save time, we can save energy, and we can save most of the important money. Lot of money will be saved. If we observe any sort of side effects with this microdosing only, then we can stop all the sequence. No need to go for further. We can just go back, check it, just make sure that the side effects will not exceed. So we will stop the complete trial at phase 0 only. So by this way we can save so much of money, time, energy, whatnot. Most of the things can be saved. So that is called phase 0. And we have one more phase called phase 4. Phase 4 is something, it's called pharmacoepidemiology. It's nothing but important. It's actually not a trial. It just ensures that you check, right? You check each and every, sorry, it's not phase 4, it's phase 5. Sorry, it's phase 5. Phase 4 is post-marketing trial, and the long-term effects will be examined in phase 4, and phase 5 is called as pharmacoepidemiology trial. Pharmacoepidemiology, it's actually not a trial. Phase 5 is just analysis. It's just analysis. It's not a trial. Okay. So with that, we just got a brief discussion about trials. We'll go for the question 4. A pregnant female of age 21 brought to the emergency with a complaint of acute seizure episodes. Now, what is the first drug that you need to go for? What's your first option or choice? Most of the doctors will straightly go for levetiracetam, lamotrigine, clonazepam. Sodium valproate, obviously it's a teratogenic drug, so we don't want to go for it. So just strike sodium valproate, we don't want that one. Clonazepam and lamotrigine are second choice. But if you come for the first choice is always levetiracetam. If levetiracetam is absent, then the second choice will be lamotrigine and clonazepam. While sodium valproate is dangerous drug, teratogenic, sodium valproate causes neural tube defects, very important. Warfarin causes anomalies, limb anomalies, to something called phocomelia, and you have something called lithium, which causes Epstein's anomaly, right? And if you go for amino glycosides, that leads to some serious ototoxic effects, even ototoxic maldevelopment also. And we'll go for the next question. So here the answer is levetiracetam. That should be your first choice, and is the drug of choice for acute seizure episode in case of pregnant. Now coming to the question 5. Therapeutic drug monitoring is not needed in. So lithium, is it needed? Yes, it's needed. Lithium is very most common side effect causing drug. Lithium. It has a lot of side effects. If you take one of the most important side effects of lithium, it's consumed in pregnancy, that is Epstein's anomaly. Very important. Write it down here. The most important side effect of lithium is Epstein's anomaly. Always remember. Don't forget this one, right? Epstein's anomaly. So aminoglycosides, yes, you need a serious analysis, serious therapeutic drug monitoring of aminoglycosides because they cause nephrotoxicity. Then coming to the next drug, sodium valproate is a very dangerous teratogenic drug. It may lead to neurological defects, very important. That leaves only one option, that is metoprolol. See, metoprolol don't need therapeutic drug monitoring. Not only metoprolol, you take beta blockers, you take hyperglycemics, anti-hypoglycemics, and you have some other drugs, etc. These don't need therapeutic drug monitoring. Why? Because the so-called levels of blood pressure itself defines whether it is in safe zone or not. So there is no need of therapeutic drug. Even in anti-hyperglycemics also, the blood glucose level itself speaks whether it is in safe zone or not. So obviously there is no need of therapeutic drug monitoring. Beta blockers, anti-hyperglycemics and some other classes are also there, but these two are very important. So that's all of today. We have 5 nice MCQs, a very brain refreshing, a small mini session, something like an MCQ. So hope you enjoy. So stay tuned for better videos, better MCQs will come in the future. Thank you. Have a good revision, have a good preparation. Thank you.